The new COVID-19 variant, which has been identified in South Africa, has become a source of concern for many countries. The new variant could possibly be worse than the Delta variant. Scientists say that this variant carries an extremely high number of mutations and could drive further waves of the disease. The new variant of COVID-19 goes by the scientific label B11529 and has 32 mutations in the spike protein. Delta had 2 mutations, while Beta had 3 mutations. Cases of the new variant had been found in South Africa, Botswana and Hong Kong and were confirmed by genome sequencing. The latest country to have reported a case of the new variant is Israel. One case of the variant first detected in South Africa has been confirmed. The infected person returned from Malawi. In South Africa, the number of daily infections has increased tenfold since the start of the month. On Thursday, it recorded over 2,400 infections, nearly double the previous day's tally. The number of fatalities shot to 114 on Thursday from 22 the previous day. The European Union is mulling a ban on travel from South Africa following the discovery of the new variant. Scientists fear it could torpedo efforts to beat the pandemic. United Kingdom has issued a travel ban from 6 southern African countries. On the list are South Africa, Namibia, Botswana, Zimbabwe, Lesotho and Eswatini. Officials at the United Kingdom Health Security Agency described this variant as the worst yet. South Africa slammed Britain's decision as rushed.
What we will be doing is from midday tomorrow, we will be suspending all flights from 6 southern African countries, and we were adding those countries to the travel red list. Those countries are South Africa, Namibia, Lesotho, Eswatini and Zimbabwe and Botswana. And we will be requiring anyone that arrives from those countries from 4 a.m. on Sunday to quarantine in hotels.
Germany has also announced a ban on most travel from South Africa. The new rules will be implemented from tonight and could affect South Africa's neighboring countries as well. Only German nationals from these countries will be allowed to enter, and they must quarantine for 14 days, even if they are vaccinated. Italy has also banned entry of visitors from South Africa, Botswana, Zimbabwe, and 4 other African nations. Its government said that the country will follow the path of maximum caution. India has also issued an advisory in order to deal with a rapidly evolving situation. All international travelers from South Africa, Botswana and Hong Kong have been put in the at-risk category. All these travelers will be screened and tested for COVID-19. Their contacts will be tracked and tested. The central government has urged state governments and union territories to adhere to the principle test, track, treat, vaccinate. Australia is also investigating the new COVID variant as it spreads. The country has warned that it may close its borders to travelers from the African nation if risks from the new variant increase. Singapore has also restricted arrivals from 7 African countries. Singapore citizens from these 7 countries can enter the city-state, but will have to undergo a 10-day quarantine. Travel is restricted for all non-Singaporeans arriving from South Africa, Botswana, Eswatini, Lesotho, Mozambique, Namibia and Zimbabwe. Well, our correspondent Calden Ogmu joins us live from Johannesburg. Good to see you, Calden. This variant is considered to be the most virulent and transmissible of all variants discovered so far. Is this reflecting in the surge, and what are experts saying?
When just everyone thought that life was getting back to normal, businesses are picking up, people had started socializing after more than a year of restrictions and lockdown, National Institute of Communicable Diseases dropped this bombshell on Thursday. So health officials and scientists say they are still monitoring the situation to determine whether this could, how this could impact South Africa. They also warned that this variant is spreading fast and the healthcare system in the coming days could experience a pressure. Health Minister Joe Patla also spoke spoke yesterday, who said that they will be holding, there will be a meeting held with cabinet ministers and the National Coronavirus Command Council in the coming days to discuss possible intervention measures and restrictions. You might have heard that some of the countries, like the UK, have already acted fast, and they have put 6 countries from Southern Africa on the red list. A total of 2,465 new cases were recorded in the last 24 hours. The government says they are prepared. They've been doing this for the last more than 1 year. So with this new variant, they're not taking any chances. Scientists are working overtime, and the government said they will update as soon as the cabinet ministers as well as the Coronavirus Command Council meet soon in the days to come.
Carlton, the second biggest concern is this variant's impact on existing vaccines. What is the reading of experts?
So, okay, let me give you a number. The health department usually gives us daily updates of new cases and deaths. So 10 days back, the number of new cases was about 200. Today we are sitting at 2,465 new cases. So you can see this is a sharp uptick in the numbers. The experts say there are about 22 cases of this new variant that has been recorded in Gauteng, Limpopo and Northwest Province so far. However, they say that this might have spread to other provinces as well, but they are still monitoring the situation to determine how this could impact South Africa.
Carlton, finally, how is the South African government geared to meet the challenge?
Yes, this is the most important question, and also something that most of the countries, including South Africa itself, is worried about. Yesterday there was a briefing from the health experts who stated that for now they are not sure on how this new variant will react, or whether or not this variant is resistant to the current vaccines we are taking. We will have to wait a few more days for the experts to update us on this, but we do know for sure that this variant is spreading and mutating fast, as the experts say. Also, one thing that they have said is that they're also studying the new positive cases on whether those individuals that have tested positive with the new variant were vaccinated or unvaccinated individuals.
WION is now available in your country. Download the app now and get all the news on the move.